I want second opinion. This is a very well-known channel now amidst most of the people, because I myself personally I have sent to many of them to utilize this opportunity, whenever they wanted. So basically, what is osteoporosis, and is it a condition or a disease?
Okay. See, osteoporosis is essentially weakening, otherwise we call it in medical terminology, the thinning of the bones. See, bone, there is bone is made up of two structures essentially. One is a bone matrix, which is the substance in which it is made of, and second is the calcium content of it. Okay. So whenever there is going to be thinning of the matrix of the bone, which can make them more fragile or more prone for fractures and stuff like that, we call it as osteoporosis. It is essentially both the density of the bone and the quality of the bone is reduced here. It is not a disease, it is a condition.
Okay, okay. So this can happen at any point of time, or it is age related?
It can happen at any point of time. Okay, so the risk factors are essentially age. Of course, age is an risk factor, wherein people who are in the fifth decade of life, there is a certain increased incidence of osteoporosis. Female population, yes, they're at a higher risk. Now, the other risk factors in osteoporosis are if any of your family members have been diagnosed with osteoporosis, then yes, you do stand at the risk of that. Hormonal changes, low body weight, wherein if your BMI is less than 18.5, which is under par, and people who take certain medications like steroids, etc. And the most important bit in this particular risk factor consideration is lifestyle factors like, what can I say? If you are not going to be a physically active individual, or if you are a smoker, then of course you are at a risk of developing osteoporosis.
Okay. You threw a light on something called, you said it is also related to your condition, and sometime back you said certain factors. Can you repeat the same factors which develops osteoporosis? Elucidate on that.
Yeah, for sure. Yeah, see, if age is taken into consideration, Sunita, what happens is female are more preponderant. 1 in 3 female after the age of 50 are at the risk of developing osteoporosis, and men, 1 in 5 male are at the risk of developing. The reason is, of course, because of the menopause and stuff like that.
Okay.
See, everything is interrelated in the sense that bone is, from what we understand, bone is it's a solid structure. Okay, but it is not a simple solid structure as we all think. Like every day there is a constant, as like the heart beats every minute, there is constant absorption, resorption, and formation of the bone that happens every day. If any particular factor that affects or intervenes with this bone resorption or reformation process will cause osteoporosis. For example, estrogen, which is the hormone which is essential in menopause and stuff like that, it has got a role in the bone absorption resorption process. Okay. Absorption resorption means what it is: bone laying and bone being sucked out of the matrix of the bone. So any process that involves in changing the environment of bone absorption and resorption, this can cause osteoporosis in simple terms. I hope I answered your question here.
Yes, you did. And you also said menopause is also another condition which is susceptible to, osteoporosis. So I think ladies have to understand the real meaning of osteoporosis and when does it occur in them. And looking out for the diagnosis point of view, how and when it will be diagnosed?
See, osteoporosis is it's as we discussed, it's not a disease. So nobody will be knowing that they suffer from osteoporosis. In majority of the times, it's an incidental finding. Yesterday, for example, one of my friends gave a call because her mom sustained a fracture of one of the pelvic bones. Okay, so the doctor advised an X-ray and then a CT scan to diagnose it. In this particular process, what happened was there was an incidental finding mentioned about osteoporosis. Immediately they got alarmed. What is this? We never knew of that and stuff like that. See, it is essentially an incidental finding, wherein it is not a painful process at all. But as a result of the osteoporosis, if you don't know about it, and then you sustain an injury, i.e. a fracture, once it becomes painful, during that particular point of time, you get investigated. At that point of time, then the doctor advises you that you have got osteoporosis. And how it is essentially diagnosed is, we do a particular scan. Now, it's not a scan, it is an X-ray. It's a different kind of an X-ray, which is called as a bone density scan. Otherwise, we call it as a DEXA scan. It measures the bone mineral density. So depending upon the findings or the valuations of the DEXA scan, then we call it as either normal bone or osteopenia or osteoporosis. Osteoporosis is minus, there are certain valuations which I don't think this comes under the purview here. Between normal and osteoporosis is osteopenia, which means it is not established osteoporosis, but it is leading on to osteoporosis kind of.
Oh, the preliminary stage of osteoporosis, is that what you're hinting on?
No, osteoporosis is established. Osteopenia is in between normalcy and osteoporosis.
Okay. This bone density test, is it when do you advise this test? If a patient comes to you of a back pain or lower back pain, something like this, is it do you diagnose and you just right away and you give the prescription for the bone density test, or it's certain parameters involved to go for this?
No, see, osteoporosis, if back pain is osteoporosis, as I said to you, is a painless condition. Okay, and it will not lead on to back pain unless otherwise, because of osteoporosis, without you knowing, a fracture has happened, as a result of which you go to the doctor and they diagnose you the fracture as a result of osteoporosis. That's when osteoporosis will be diagnosed. If you come to me with back pain, and then I do an X-ray and I see some fractures which you never knew, and you will tell me that, no, I never sustained a fall or anything at all, but I do not know how the fracture happened, means, see, for example, if I'm telling you a condition, let's take about the spine. Okay. When osteoporosis happens, what happens is, I told you, the matrix of the bone becomes thinned out. It is like an eggshell. Okay. Now, even with a violent cough or trivial trauma, if you are going to exert pressure, this eggshell kind of a bone, because of osteoporosis, because of thinning of the matrix, can crumble just like that. Okay, that's when the osteoporosis, that's when the osteoporotic fracture happens, as a result of which you will come to the doctor for back pain, and then we will tell you you have got osteoporosis. So at that point of time, what we will advise you is, go get a DEXA scan. We will also do some medical examination, some physical examination, and if need be, some blood tests and etc. for diagnosing osteoporosis.
Okay. So this can happen in any part of your body, not necessarily the spine area alone, correct?
No.
If the fracture, generally fracture happens in your arms, your wrist, or anywhere.
Of course, yes. See, osteoporosis, matlab, it is thinning of the bones, and it can happen in all the bones of the body. It is not area specific or anything at all, but the brunt of it is taken by three important structures in the body. One is the spine, second is the hip bone, and third one is the wrist bone. So elderly age group, these are the three common injuries that happen. For example, if we are walking and if you trip and fall down, either will land on your outstretched hand, as a result of which you develop your wrist bone fracture, or you develop your hip bone fracture. With or without your knowledge, you will develop a spinal fracture.
Okay. See, I have a person who met with an accident, minor accident. He was operated for the wrist. So
Okay.
he was operated. Okay.
Yeah. Yeah.
So, which means that person is susceptible to osteoporosis condition, or not necessarily that he or she will be diagnosed for such conditions in future. If,
Uh,
for
it depends upon the which age group who comes to you with the fracture of the wrist. Number one.
40 plus, take it as 40 plus.
See, 40, and the second thing is, was it a trivial trauma, which means the intensity of the impact? If normally a bone is a very high density structure. If you are
Okay.
going to fall like that, it is not susceptible for breaking or anything at all. But if the low velocity injury, you fall down, and if you sustain a fracture, then the index of suspicion of osteoporosis needs to be high. That's what I mean to say here.
Oh, okay. Most of them have this problem of back pain, and sometimes knee over the period of time, 50, 45 plus, 50 plus, they have this knee issues coming up, joint problems. Do you advise this DEXA the test scan, or whatever you call that as, for those people to find out they have this condition, osteoporosis, or it is not connected to that in any way? Can you, because I'm asking in the layman's term, because
No,
most
no,
of
no,
this.
no, no. Exactly, you are right. In the sense that this is a very common misconception that people do have. They always confuse osteoarthritis with
Exactly.
osteoporosis. See,
Yes.
osteoarthritis is elimbu theimanam leading on to joint getting wear and tear and etc.
Correct.
It has got nothing to do with osteoporosis. Osteoporosis means the bone has lost the density,
Okay.
uh, as a result of which it is thinned out and it is very fragile. Whereas
Okay.
arthritis is elimbu theimanam, wherein
Same one.
the joint has worn out and it has got and it gives you pain. So if you go to the doctor for arthritis of the knee joint and stuff like that, there is no indication for investigating you for osteoporosis. Both are totally different condition.
ஓகே ஓகே. ஏன்னா பிகாஸ் இது வந்து மோஸ்ட் ஆஃப் தம் என்ன நினைச்சுப்பாங்கன்னா, திடீர்னு நமக்கு முட்டி பெயிலி வலிக்கிறது, ஜாயிண்ட் பெயின் வலிக்கிறது, நமக்கு ஒருவேளை ஆஸ்டியோபோரோசிஸ் இருக்குமோ அப்படின்னு ஒரு பயம் வரும் வயசானவங்களுக்கு. See,
Exactly.
generally இது ஏதாவது prevent பண்ண முடியுமா? Osteoporosis, can it be prevented? Is there any
Of
way?
course, yes. Yeah. Osteoporosis can certainly be prevented. One is health education, obviously. Okay. See, prevention, how it happens is, most important is adopting a healthy lifestyle. If you are going to be sedentary, once again, I will come back to the old example we talked about. For example, if you sustain a fracture and if you have been put on a plaster, and after removing the plaster, you see that the whole arm is wasted. Okay.
Yes.
Adhe marda, if you are not going to be as active and if you are going to lead a sedentary life, it is equivalent to your arm being put on a plaster and the muscles,
Okay.
everything get wasted. Okay.
Okay.
If you
Okay.
are not going to lead an active lifestyle, then yes, of course, osteoporosis can happen. So from being a sedentary lifestyle, change it to normal lifestyle. That's number one. Number two, diet. Include diet rich in calcium and vitamin D. That is
Okay.
important. Number three, regular exercise. That is important. And for people who smoke or involved in excessive alcohol consumption, these are all high risk factors. So these are the prevention methodologies that you need to keep it in mind.
Okay. Okay. Again, lifestyle modification வந்து இந்த இதுலயும் வருது. So totally நமக்கு பாடியோட என்ன கண்டிஷனுக்கும் lifestyle changes and physical activity has become part and parcel.
எல்லாமே lifestyle modification தான் at the end of the day. That's how it comes into. Yeah.
Okay.
Being aware of it, health education, and சாப்பிடுற சாப்பாடு and being active.
So how do we go about it if you was diagnosed for osteoporosis condition? So what is it? Can it be once we go for the doctor's diagnosis and you get everything, all the preliminary tests done, you're into medication, will it be a lifelong process of you're on medication, or can it be reversed also?
Yeah. See, the multiple factors. See, treatment வந்துட்டு what we told was osteoporosis is thinning of the bones. It's not like kind of an irreversible condition or anything of that sort. It is certainly a reversible condition. We will have to strengthen the bones in order to prevent the fractures happening. Okay, va? So once again, treatment of osteoporosis வந்துட்டு எப்படி preventionல வந்துட்டு என்னென்னமா சொன்னோமோ the same thing applies for treatment for osteoporosis as well. First is lifestyle change. Second வந்துட்டு regular weight bearing exercises. Once osteoporosis வந்துடுதுன்னா, then you need to put on regular weight bearing exercises, like in the form of toning exercises, regular walking, if you're into dancing and stuff like that. But regular walking in itself is a regular weight bearing exercise. And balanced diet with sufficient amount of calcium and vitamin D. This is mandatory. Apart from that, these are all from the patient's perspective.
Okay.
But from a doctor's perspective, that's when we will come to see whether we need to put you on medication or anything at all, depending upon the severity of the condition of how bad the osteoporosis is there. That's what it is about.
Okay. So when you talked about the calcium deficiency, so the calcium deficiency occurs in menopause stage. And one other condition is if you are hypothyroid, your body is deprived of absorption of calcium. So are these people, this category of people are, have the, problem of getting osteoporosis in the early stage itself? Because years together, we've been on medication. I mean, whoever has got hypothyroid has been on medication, and unknowingly they have not taken supplements. Supplements generally you people give for either calcium. So if you don't take calcium supplements also, so body is completely deprived of calcium. So what is it that you suggest for those people?
See, we talked about the bone physiology there, in the sense that bone நம்ம பார்க்கிறதுக்கு வந்துட்டு solid structure. But I told you, although it's a solid structure, there's a constant process of absorption and resorption and bone formation that is constantly happening. And this is influenced by multiple factors, of which we discuss about the role of estrogen, which is the menopausal hormone and stuff like that. And the other hormone, which is of great importance, is this thyroid hormone. Okay. Thyroid, parathyroid hormone has got a definite influence in the physiology of bone resorption and bone laying, which is a constant everyday process that's been happening in the bone. So whenever there is a hyperthyroid or a hypothyroid condition, or if the estrogen is going to be low in the body, then of course the bone density is going to be affected. And depending upon what is deficient here or what is in excess here, like if it is a hyperthyroid condition, treat hyperthyroidism accordingly. If it is hypothyroidism, treat hypothyroid condition accordingly. If it is going to be menopausal condition, if appropriate, HRT, depending upon weighing the balance, because HRT itself has got a lot of problems associated with breast cancer and stuff like that. So one has to be cautious in making sure that they get appropriate treatment. One has to wait on the balance, essentially.
What is it, HRT you talked about? What is it? What is HRT?
HRT is hormone replacement therapy for menopausal women. See, osteoporosis becomes common after menopause because of the estrogen deficit. Okay.
Yes.
Especially during the first few years of menopause. So one has to be careful, make sure that even though if you don't want to take HRT, hormone replacement therapy for menopause, which can indirectly cause osteoporosis and stuff like that, if you can complement that or take alternative measures in the form of vitamin D, calcium supplements, active lifestyle, etc., etc., you might not necessarily need to take HRT, but in certain group of people, it might become necessary.
Okay. Um, Another thing is, you said in the beginning itself, you said taking of steroids can, give problems. You can lead to osteoporosis. See,
Right.
I knew certain people who've been into steroids for a longer period of time.
Of course,
For
yeah.
about 1 year,
Yeah.
2 years, 3 years for their treatment.
Mm.
So they needn't be of 50 plus age or something like that. Even in my age group, I knew people. So are they vulnerable to this kind of an condition? See,
Of
even
course,
if they have stopped over the say about 6 to 7 years, they have been on steroids and they have discontinued after that, or rather, the dosage is reduced relatively. So are
that's
these people vulnerable to this condition in future?
100%. People on steroids, they uh, they will become osteoporotic, and as because of the osteoporosis, they will sustain fractures. So one has to be very vigilant in patients on steroids. For example, if the patient is on steroids for rheumatoid arthritis or other
Yes.
rheumatologic conditions, then one has to be very they should be monitored on a regular basis for this osteoporosis. Otherwise, they will develop fractures.
Okay. See, if you're going for, mentioned arthritis, rheumatoid arthritis. So when you go to the doctor, will he be able to, I mean, by giving those medicines, those medicines which are vulnerable to cause osteoporosis to you, will they be initially diagnosing them for osteoporosis also simultaneously along with the conditions that they are treating now on?
No, no, no. See,
Oh,
when you go to the doctor for rheumatoid arthritis and stuff like that, their priority is to try and control rheumatoid arthritis. Okay,
okay.
because osteoporosis is a pain-free condition. It is never going to give you pain. So unless otherwise it is going to give trouble to you, why would you go and make yourself put yourself in a situation for diagnosing you with unnecessary condition? And also, osteoporosis will develop with steroids after a period of time. So it is not necessary, but from the health education perspective, it is better if the doctor says to the patient that be wary of the condition called osteoporosis on long-term steroid intake. That's what it should be, health education, and making them aware of what might happen.
ஸோ இப்போ வந்து நம்மளா இப்போ இந்த மாதிரி ஸ்டிராய்ட் சாப்பிடுறவங்க நம்மளா போய் அந்த டெக்ஸா டெஸ்ட் எடுத்து பார்க்கலாமா? நம்ம
Oh,
உடம்புல ஆஸ்டியோபரோசிஸ் இருக்கா இல்லையா, அது ஃபர்தரா அது ஏதாவது ப்ராப்ளம் கொடுக்குமா? இல்லைன்னா யூ கேன் ஜஸ்ட் லீவ் இட் அண்ட் லீட் யோர் லைஃப் as such without even undergoing these tests and unnecessarily putting pressure on yourself, because you're already into so many conditions of and medications, so they might neglect, most of them will not be able to understand even that this condition is possible at this stage. So I
yeah,
just
yeah.
want to know, can you live with it, osteoporosis? Without knowing if you have osteoporosis you develop over the period of time, is it okay to live with it even without?
Of course, it is okay to live with it, but the problem is once osteoporosis is established, then how it is going to affect. So, I
Yes.
told you there are only three places where it commonly affects. One is the wrist bone fracture, second is a hip fracture, and third is a spine fracture.
Yes.
Now, if a Vaisaga வந்துட்டு, what happens is you can see patients from standing upright and then
Yes.
they கூன் விழுந்துருது இப்படி.
ஆமா,
What is
இதுதான் நான்
this?
கேட்க வந்தேன்.
What exactly is this கூன் விழுவுறதுன்னா வந்துட்டு, normally a vertebra is rectangular in shape like that. Okay. With osteoporosis, as I told you, this becomes like a eggshell because the
Okay.
density in the bone is reduced. Okay. What will happen is, with or without your knowledge, this bone, which is rectangular in shape, will collapse like that and become a triangular in shape.
Oh, deforming.
Deformation. So imagine normal vertebra, which was like completely rectangular in shape like that. Okay. Now what happens is if this one becomes kind of a trapezoidal in shape, mukkonama maariduchna, if all the vertebrae rather than becoming being rectangular, if it is going to become triangular, what happens is you tend to coon.
Stoop.
You will stoop forward. Okay, that is what happens with or without your knowledge. The fractures can happen spontaneously without your knowledge, and you, over a period of time, you will be noticing two things. I was 6 foot 4 inches tall. Now I become 5 foot 7. How did that happen? Number two, I was standing erect at that point of time, but without my knowledge, you can see all our old Tata parties
Yeah.
over a period of time on the coon போட்டு நடக்க ஆரம்பிச்சிருவாங்க. So these are all the things that happen. This is from the spinal perspective. But to your question, can we live with it? Yes, of course we can live with it because it's a pain-free condition. But when the fracture happens as a result of the osteoporosis, then it becomes a problem situation. Like, for example, if a patient develops a neck or femur fracture, hip fracture, it's life-altering condition. Okay, wherein Surita, if I can remember your father,
Exactly.
he had a neck or femur fracture.
Yes, you can.
And how it affected his quality of life.
Yes.
See, these things will be there. The mobility decreases, everything changes for you. So that's what happens. So that is the importance of osteoporosis. This is easily, even for a trivial trauma, they will sustain a trip, they fall down, and then they develop this fracture. Would you want to develop sustain a fracture just because of trivial trauma, just like that? Of course not. So that's what it is about.
Okay. Another thing, இப்போ வந்து கீழே ஸ்போர்ட்ஸ் பீப்புள்லாம் they often get fractured at times, விழுந்து அடிபட்டுக்கிறது. It's quite common in sports field. So இந்த மாதிரி இருக்கிறச்சு அவங்களுக்கு அந்த அடிக்கடி fracture ஆகுது, அடிக்கடி they go for in case they have surgeries done, will this have an effect on in their future this osteoporosis?
No. See, if a sports personality is going to sustain a fracture, it is because of a high intensity velocity injury. Okay. Whereas osteoporosis patients developing fracture will be because of low intensity velocity. தடுக்குன கீழே விழுந்தா சப்போர்ட் பண்ண பார்த்தா பொட்டுன்னு கை உடஞ்சிருச்சு, கால் உடஞ்சிருச்சு. So that's what it is about. If you are going to develop a fracture in the spine, sometimes you might develop a violent cough or a violent sneeze, followed which you will develop a severe pain in your back. See, spine, there are 33 vertebrae in the spine. Okay. Now imagine one vertebra developing a fracture. For one vertebra to heal itself, it will take approximately 3 months. And this can lead to chronic pain as well. So every time when a fracture happens in the spine, it is such a painful condition. And for that to heal and for the fracture pain to settle down, it will take 3 months' time. And in around 20 to 30% of the patient, although the fracture heals, it becomes trapezoidal in shape. Mukkonama mari poitu, biomechanical axis la vandu the pressure points alla mari, then it leads to chronic pain. So imagine acute pain for 3 months followed by chronic pain for the rest of their life. Is it nobody would like to have it or want it?
Definitely. So this is what and diet, talking about diet. So you initially said vitamin D rich diet, and you said calcium rich foods. What about protein? Generally, people have to take எல்லாருமே சொல்றதுதான் protein rich food சாப்பிடுங்க, protein எந்த டாக்டர்ட்ட போனாலும் protein rich சாப்பிடுங்கன்னு சொல்லிட்டு. So அந்த மாதிரி protein rich food, can you just give a hint on those things? பெரியவங்க வீட்ல இருக்கிறவங்களும் சாப்பிடுற மாதிரி, சின்னவங்களும் சாப்பிடுற மாதிரி, any diet modification which can be done to avoid such conditions?
Yeah, of course. See, there is no direct correlation between protein intake and osteoporosis. Okay, but osteoporosis is mainly because of you need to make sure that you have to take a diet rich in calcium and vitamin D, which is crucial for your bone health.
Okay.
You can you can have dairy products, அப்புறம் வந்துட்டு leafy greens and fortified food which are good in calcium. அது வந்துட்டு that's good. And of course vitamin D through sun exposure,
Yes.
And once again, a lot of foods, if a cereal, a lot of fortified food. Even if you are going to take milk, for example, fortified milk is available. Vitamin D enhanced, calcium enhanced, and மாதிரிலாம் இருக்குது அது. So these
Mm-mm.
are that you need to be concentrating on if you are diagnosed with osteoporosis or in order to prevent osteoporosis developing. Protein as it is doesn't play a too big a role in osteoporosis. Protein
Okay.
we will talk on another day. That's a big
Okay.
topic in itself. It's my favorite topic. Let's talk it on another day. Yeah.
Definitely, definitely
But
we
in
will have
the
it.
condition, let's not give too much importance for protein, either in the prevention of osteoporosis or in the treatment of osteoporosis. Yeah.
Okay. What about exercises? If you are diagnosed with osteoporosis, is it individualized exercise that you recommend, or generally you have a preventive exercises also? அந்த மாதிரி
Hmm.
இருக்கா? Can you categorize on that?
Yeah. See, exercise, we came to a conclusion in the early part of our discussion is active lifestyle.
Yes, like
That's the most important bit. And weight bearing exercises. That's what the title is essentially. என்னன்னா வந்துட்டு normal walking is a weight bearing exercise. அப்புறம் வந்துட்டு நம்ம இதுல people talk about Zumba dancing,
okay.
those kind. Then other thing is strength training exercise. Are important.
Okay.
See, in the process of weight gain, people do advise about fitness and weight reduction. But
Yes.
people tend to, in the whole process of weight reduction, what happens is a lot of people go on a running spree or a walking spree and stuff like that. Thereby, they tend to reduce their weight. But what they forget about in this particular methodology is whenever you are going to be involved in significant running or significant walking, wherein you are going on a negative calorific balance, okay? Negative calorific
Mm.
balances. I think we're deviating from the topic, but just a small, what happens is if you are going on a negative calorific balance, unless otherwise you are going to be involved in strength training, which means you have to do resistance exercises of the
Mm.
muscle. Otherwise, what will happen is you will lose the muscle bulk. Nonja mari aiduvam.
Correct.
If you're going to look at a marathon runner,
Mm.
okay, majority of the marathon runners, if you see, they will be like nonjans only.
Mm.
Okay, they are not going to be hefty built or anything at all. Okay, so the importance needs to be given to toning of the muscles, which can only happen in strength training, and people should not forget toning while they are involved in weight reduction or weight maintenance, walking or running kind of stuff. That's very important. Sorry, I'm going off the
No,
track
no, no.
here.
You just hinted right on this. And because in the strength training, பண்றவங்களும் பாக்குறாங்கல்ல in the videos. So whoever watches, they'll have an idea of how this should be done and all that. I think you have thrown light on all the aspects, wherein the bones are involved. I guess these are the questions that I have from my point of view. ஒரே ஒரு கொஸ்டின் தான். இந்த மெனோபாஸ் ஸ்டேஜ் வந்தாலே இந்த ஹார்மோனியல் இம்பேலன்ஸ்னு ஒரு வார்த்தையை சொல்லிடுவாங்க டாக்டர்ஸ் எல்லாம். சோ நாங்களா அந்த போன் டென்சிட்டி டெஸ்ட் பண்ணிக்கலாமா ஆஃப்டர் 45 இயர்ஸ் பண்ணி கண்டுபிடிச்சிக்கலாமா எங்க கண்டிஷன் ஆஃப் தட் போனோட டென்சிட்டி எப்படி இருக்குன்னு, இல்ல
Yes, of course it is important. See, after the age of if it is going to be early menopause, then yes, it is mandatory to get yourself tested for this bone density via the DEXA scan. And see, what happens is once you are diagnosed with the osteoporosis, the treatment one that apart from the lifestyle factors and the patient factors that you will have to put in place, what we doctors tend to do is we start you on medications appropriately. I'm not going into the details of the medications and stuff like that because it might be away from the purview of this particular discussion topic. We can go into those details if people want to talk about on treatment of osteoporosis with the help of medication. But osteoporosis once diagnosed ஆயிடுச்சு and if it is severe அப்படின்னா வந்துட்டு then we will start you on appropriate medication. And for the medication to take effect, it will take approximately 6 to 12 months to happen.
Oh.
And one has to take medication for up to 5 years time. And
Okay.
after that, every 1 to 2 years, it is better to get this DEXA scan done. DEXA scan,
Okay.
it is a kind of a scary word. It's not a big scan or anything at all. It is just an X-ray at the end of the day. And based on the values we determine, we will tell you whether you got osteoporosis or not. So just undergoing an X-ray is not harmful at all at the end of the day. Every 1 to 2 years, you can, of course, go and get yourself checked rather than putting yourself at the risk of developing the spinal fractures or a hip fractures because of very trivial trauma that you might sustain.
Thank you so much, Prakash, Dr. Prakash. Uh, you really helped me understand on a whole what is osteoporosis and how should we go about, in future, should take care of our health. Thank you for your time.
No
And
worries.
please
It's my
continue.
pleasure. ஆனா 40 நிமிஷம் போயிடுச்சு பாத்தியா நம்மளுக்கே தெரியாம அந்த 40 நிமிஷம் யூஸ்வலா ஓடி போயிடும்